You might assume that the UK has robust data about the condition of the population's eyes, as well as the prevalence of eye disease. But not so, according to...
So I'm Mike Bowen. I'm the Director of Knowledge and Research at the College of Optometrists, where I've been for 15 years.
The issue is we don't have a centralised data gathering organisation. That would collect all the information that we need. There are lots of data streams out there, such as the Certificate of Visual Impairment, or CVI data, but the issue with this is it comes towards the latter stages of a person's journey of eye health. Getting good, clean data is the plan of Mike and the organisation he works with, the UK National Eye Health and Hearing Study. Mike presented their plan at the Hospital and Specialty Optometrists Conference. The UKNEHS wants to run a survey finding out in-depth information about the eye and ear health, which can be generalised to the entire population.
We'll select a random sample of people to participate. The statisticians who are working with us have calculated the number that we need to get a reliable estimate of the prevalence of blindness for the UK population. And that number is 25,000. And those people will be examined. They'll have their sight tested in a really comprehensive way. We'll have audiology tests to get the hearing loss data. As well as the national level data, the UKNEHS will be done in such a way that it will provide a degree of local level data, and that's really important. Hearing and vision are both in the situation that not only do we not have the good national population level data, but we don't have local data. And then on top of those data, we'll be asking people to fill in some questionnaires about their self-reported quality of life, their activities of daily living, the kind of things they can do and can't do, and we'll be able to then look at how vision loss and hearing loss may affect what people do. We'll look at cognition, so we can see if there are associations between vision loss and things like dementia.
In the study, they will also be asking the participants questions about their experience of eye and hearing health services. This should provide information about the barriers to access across the country. The UKNEHS would only be looking at people over the age of 50, however.
The prevalence of the major eye diseases goes up dramatically after 50, and with each decade beyond 50, it also creates a bit of an exponential curve of increase. Rather than doing the whole adult population, statistically to get a reliable sample for, say, everyone over 18, we'd have had to get data from a couple of million people, and that seemed too big a project, too big an ask, because funding would have been quite extraordinary. Everything that we've done to develop it so far has been funded by charities and organisations like the College of Optometrists, and that isn't going to be able to provide that level of funding for the complete project. So we do have a Treasury-approved business case which contains the detailed costings for the project. One of the difficulties about getting those really kind of nailed down is that until you've tried it in the pilot phase, it's quite hard to estimate what those costs will be. At the moment, to do the full sample of 25,000 across the whole of the UK, that estimate currently stands at about 15 million.
CVI data shows us that in 2021, almost 3,000 people were losing their sight due to glaucoma, and nearly 1,000 lost sight due to diabetes.
These are things that we should be preventing. This is when the WHO talks about preventable sight loss, that's what they're talking about. And that's in 1 year. And so, although a total of 4,000 people from those two causes may not sound like a big number, the lifetime cost for glaucoma, visual impairment due to glaucoma, is currently estimated about £50,000. Just on that human level, we have to do better at looking at what that true level of vision impairment is, because if that's what's coming through the CVI, I think we can be reasonably confident that there's a lot more of it out there that we are not seeing. And we also need to understand why people are coming into services at a point where they're already experiencing vision loss. So it is starting imminently. So we are now in the first week of November. We have our first ethical approval for the care home phase of the pilot study, where we'll look at 250 people living in care homes. And so data collection in the care homes will be starting in late November through to December. Some of that may carry on into January. And then in spring of next year, 2024, the community section of that pilot stage will start. And so between now and December, optometrists in the kind of Cambridgeshire, East Anglia, ICB, Integrated Care Board areas can expect to receive some kind of communication from the college on behalf of the UKNEHS team, just to kind of give them those simple sheets of data. So they go, what should I say if a patient asks about this? Well, here's what it is. So it will hopefully help you just feel reassured that you can lay your hands on the information if you get questions from patients.